What is the history of gender dysphoria and identity? Imagine living every day feeling like your true self is something entirely different from the body you were born with. That feeling has existed for centuries, even if it wasn't always understood or accepted. Today we know it as gender dysphoria, but its story stretches back over 100 years. In the early 1900s, doctors and scientists started paying attention to gender identity. In 1919, a German doctor named Magnus Hirschfeld opened one of the first clinics to help people who felt their gender didn't match their sex at birth. This clinic offered counseling, hormone treatments, and even surgeries. They also used what was called the real-life test, where patients would live as their true gender before any medical procedures. In the 1930s, the first gender-affirming surgeries happened in Berlin. Dora Richter and Lily Elba were among the first transgender women to have vaginoplasty, a surgery to create a vagina. These efforts were brave and pioneering, but society still saw gender nonconformity as a mental illness. Back then, understanding of gender was mostly seen as a binary, either male or female, and anything outside that was often misunderstood or stigmatized. Moving into the middle of the 20th century, the term transsexuality appeared in medical books around the 1940s and 1950s. At first, it was mixed up with homosexuality, but over time, people began to see it as a separate experience. The 1950s brought more public attention thanks to stories like Christine Jorgensen, who became famous after her gender-affirming surgeries. Her story helped change how people viewed transgender individuals and brought more awareness. In 1980, the American Psychiatric Association included gender identity disorder in the Diagnostic and Statistical Manual of Mental Disorders, or DSM. This was a formal recognition, but it also meant that being transgender was seen as a mental health issue, which caused some controversy. Still, it was an important step toward understanding and supporting transgender people. From the 1960s onward, clinics in the United States and other countries started offering more comprehensive care. Johns Hopkins University opened a well-known gender identity clinic in 1966, which helped develop new ways to treat and support transgender individuals. Despite some setbacks, like the clinic closing in 1979 due to societal pushback, progress continued. Over time, treatments became more personalized, including hormone therapy and surgeries that matched a person's gender identity. Today, we see a much clearer understanding of gender dysphoria. It can start in childhood and last for many years if not addressed. Many transgender people face mental health challenges like depression and anxiety, often because of societal stigma or lack of support. But access to gender-affirming care has been shown to improve mental health and overall well-being. Understanding this history shows how far we've come from misunderstanding and stigma toward acceptance and respect. It also highlights the importance of supporting everyone's right to live authentically. Recognizing the journey of gender identity helps us create more inclusive environments where all people can feel safe and valued.